Hi, good evening, my beloved colleagues. Welcoming to all of you to today's very exceptional, important session, especially for the OSCE candidates. But this is our pleasure to congratulate our colleagues who have passed the OSCE in the meantime in the last session. It will be our pleasure to introduce them and we will hear from them. I find our colleagues already available now, and those who will be a little late, let them join later. I can remember that you have attended our last OSCE sessions, and almost we covered in short description total 10 days cases. So I can see now here Dr. Arif is here. Dr. Arif, can you hear me, please?
Yes, sir. Assalamu alaikum.
Salam. Thank you very much, Dr. Arif, to be in time rather earlier, possibly,
Thank you,
join
sir.
with us.
Yes.
And Dr. Habib, I found here Dr. Ganga also there. Very good. And on behalf of myself, as your colleague, as your mentor, I don't know where about Dr. Sandamali. Are you here, please, if you are here? And any other colleague who have passed, possibly today in today's session. It's my humble and cordial welcome and congratulations to you. And as well as from our institute, it is DOAMS. And DOAMS family is very happy to get you here. And we are praying for you for your next sphere of the life. But our main agenda to listen from the colleagues. And for Dr. Arif, may I request to start with us and other colleague, Dr. Ganga, Dr. Habib can join in between also, no problem. Just to initiate the talk, what we like to hear, and our colleague also may ask you, possibly you will not mind.
Yes.
But my thinking is that first thing I like to know on behalf of all of the participants, actually during the preparation and even after immediate after your preparation, what did you expected about your OSCE exam and what did you find in the station? I will tell you the next question later. Dr.
Okay,
Arif,
sir.
please, can you introduce yourself and then proceed further?
Yeah, thank you very much, sir, for giving me the opportunity. Yeah, my name is Hussein Muhammad Zulfikar Ali. My nickname is Arif, and I am also a beloved student of Usman, sir, since 2017. I completed MRCP under his mentorship, and also I have this good fortune to crack this MRCP GP international exam under my sir's guidance. All prayers to Almighty. Sir, first of all, I did actually I got actually very less time to get prepared, only less than 2 months. So, to be honest, I was in a little bit fear that whether I will be able to crack that exam or not. But since you guided me actually for the last 2 months, and the cases that we discussed in your under your guidance, yeah, it was almost the similar cases. Sometimes the prompts or the concerns may be different, a bit different. Sometimes it may happen because the colleges, Royal College or the other dignitaries, who used to change the scenarios for making the exam competitive. That's a different one. But from my side, my experience was pretty good. That what we experienced here we and especially I got the same type of almost same type of uh, cases there, although cases
May
were
I interrupt Dr. Arif a little here? Just
yes, sir,
just
please,
to
please.
encourage your talk.
Yes,
Same
sir.
case means so far I remember that you were
Hmm.
under our 50 case, maybe 50 case practice session.
Yes, sir.
So by the number of the case, it may not satisfy the whole case spectrum in the exam.
Yes,
But
sir.
similar, I think you mean that the structure of the stations,
Exactly, sir. The
the
prompt.
yeah prompts and technical aspect of the case, I think you mean, is it?
Exactly, sir. I mean the entire, yeah, because before entering to the cube, there are certain instructions for us.
Right.
So I found those instructions relatively identical to the coaching that we did.
Oh, fantastic, fantastic.
And because, yes, the one thing that I got, that the surrogates were more prepared. Surrogates usually much more prepared, and they also guide us. That one thing that I, because my first encounter it was, so I thought that it is a pretty well balanced exam, on from my point of view.
Oh, very right, very right. So, did you find anything exceptional you didn't expect at all, but you have to face in the exam?
Sir, sometimes they may put the cases in on my exam day. The cases were relatively straightforward, I would say.
Oh, very good, very good.
Relatively straightforward, but maybe it was in my radar. That's why I'm telling. But few cases were there, one or two, that were their concerns were a little bit away from the normal. Okay, doctor, I am having this a presbyocusis. I need surgery. Can I do it like this? So maybe sometimes we didn't practice this sort of prompts, or this sort of concerns we didn't meet. So it might happen. It
Yeah,
might
it's right,
happen. It
right.
might happen. So anything, because the patients can ask anything they want. So if we get a better preparation for this sort of tackling this sort of prompts, or the concerns, meeting this sort of concerns, that would give us an extra confidence, I think.
I think what you narrated is called in the place of uncertainty. What
Yes, sir.
will we do? This is another skill, special
Yes, sir.
skill.
Yes, sir.
I may not know everything. I'm human, right?
Exactly,
I
sir.
may not know
Yes, sir.
100%, but
Mhm.
technically how to overcome this issue, this is
Yes, sir.
also part of the practice and others. So thank you, Dr. Arif. Up to this now, you can
Mhm.
be attached with us until at the end. But may I introduce Dr. Ganga now here, please?
Sure. Thank you,
Dr.
sir.
Ganga,
Please.
Hello, sir.
regarding
Good
regarding
evening.
this, hi, doctor. Regarding the issues, what did you expect and what did you find? We are moving around this. What is your experience in short? Dr. Arif possibly nicely elaborated much thing.
Yeah,
Your addition.
yeah. I think some of the cases were straightforward, but some were gray. So the diagnosis was not clear. So sometimes we had to give differentials. We practiced that during our coaching session with sir. So I was not worried that I have to give DD. So I thought I'll do like that, and did one or two cases like that.
Okay.
So the other cases were straightforward, but as Dr. Arif said, there were multiple problems from the patients which they wanted to explain. So it's not just a theory. We have to face a situation and do what's best. So I think passing or getting down in the exam, I think that had depended on that because everyone knows the theory and everyone is getting prepared for the case. So the unexpected things they might ask, so we have to handle that in a nice way. So I think I got a good experience during Dr. Osman's coaching session. So what to tell how and manage in such a situation. That is the thing I have to say especially.
Thank you, Dr. Ganga. You commented the diagnosis sometime not clear, right?
Yeah, they
And
we have to
and
give
you
differentials, right?
yeah, very right, very right. This is important question from our colleagues also. Sometimes they told that, sir, I didn't get the diagnosis. I was puzzled. because my diagnosis possibly was wrong. So what does it mean? Even we couldn't reach a specific diagnosis, even then we could pass, right, Dr. Ganga? Like you, for
Uh,
example.
no, I think, for example, there was a abdominal pain case. So I told about that case. So we cannot tell a exact diagnosis for abdominal pain and tenderness with the fever. We cannot tell like we cannot see the abdomen and tell what is going on. So I just gave differentials for that one. That's what I said. So I
And
think giving differentials is uh, not a reason to get failed in a case. So I think
exactly.
it is a way of thinking other than jumping for a diagnosis straightforward as it's in our mind. I think we have to see the case as a patient. We have seen in the clinic a normal patient. We don't know what is going on, so I think it's safe. I think it's a kind of a safe practice.
Very right, very right. So it means that if I cannot reach a specific diagnosis, minimum I have to reach some differentials. It will be good enough. And sometimes diagnosis may not be clear. And as a GP, the difference between GP and the specialist is GP usually suspect the diagnosis, specialist confirm the diagnosis. There was an old thought, a recent thought, what you have passed OSCE, actually you became a specialist in the family medicine. It is not as like as GP is a primary care physician, primarily not like that. So as they are testing us as specialist, actually diagnosis is very important outcome in our consultation. Even then, what Dr. Ganga said, I understood that if you cannot reach the specific diagnosis, minimum design some differentials, and it could be safety for you. What I understood from Dr. Ganga's talk. Am I right, Dr. Ganga?
Yeah, yeah.
Very good, very good. So any exceptional thing, doctor, you have faced in the station in any way?
Uh, I think most of the cases were like we discussed in the sessions, like acute cases, chronic cases, and
That I like to say,
these
you
are the
didn't go,
types.
sorry, sorry to interrupt you. You didn't go through all the cases with us, but you
Yeah,
practice the different categories of the cases, right? This is
yeah.
the technically advantageous position to practice the different types of the cases because knowledge is endless. So very good, doctor, to hear from you. I think we can hear from you a little bit later more also. In the meantime, any other colleague who have passed actually with us, even without us, also no problem. Anybody can share your opinion. Any other colleague, you can open the mic because I cannot actually call you also. If you are here, we will be very happy if any colleague join with us. Already passed the ASCII. Dr. Habib is here. I find here Dr. Habib.
Yes, sir. Assalamu
Welcome,
alaikum,
Dr.
sir.
Habib. Salam. Dr. Habib, I think you are following us, our talk
Yes, yes,
up
sir.
to now.
Yes.
So, do you like to add anything more in this issue that your expectation and your observation in the exam?
So expectation is the time management is okay, sir. Except some stations I did not get the proper time management. But the unacceptable thing is that some I did examinations in my one stations. It's a occupational asthma. And when I did the examinations, the examiner will forget to give me the examination findings. Then I asked the examiners, is there any positive findings, sir? So then he will give the answer. This is the only exceptional things. And any other stations, the SP was old ages, and he was forget to tell me the drug history. And when I just asked him, what is your expectations or from my side. Then he was told me, doctors, I'm sorry, I am really forget to tell you that I am on HRT, hormone replacement therapy. You also really forget to give me the answer. So these two things is unexpected. So the whole stations and rest of the things is are okay. And I think examination, the stations which includes examination, it is good. But in counseling stations, when we were already finished the agenda, main agenda before the times, then some questions like unexpected questions or some extra questions they will ask you, some irrelevant questions or relevant questions. This is also.
Thank you very much, Dr. Habib. Be with us. In the meantime, our participants today, do you like to ask any question? Anything about the exam until you have heard? We'll go to the other issue also of the exam from our colleagues, Dr. Habib, Dr. Ganga, as well as Dr. Arif also with us.
So I did not get you. What is the question, sir?
No, not to you, other colleague, those who are
Oh,
listening.
okay. Yes, sir. Yes, sir.
Will they feel pleased to ask the question or comment about what they have heard today? Only listening? I'm trying my best on behalf of you asking the question to them, but any colleague, please. Dr. Javed, are you here?
Assalamu alaikum. First
Salam.
of all,
Yeah, Dr. Javed, please.
all my colleagues, Dr. Zulfikar, Dr. I think his name is probably nickname Arich, and Dr. Habib and Dr. Ganga.
Right.
I would like to ask that how did you prepare apart from Dr. Usman group or course? So did you have any partner to study, or you did or everything is the course?
Dr. Habib, I think, can continue.
Yes, sir. Thank you, Dr. Javed. So actually, in the OSCE, I feel the difficult task is to be find a right partner. So it is a very important thing. A good partner is very essential to pass a OSCE. And Osman sir helps a lot in this background because I learned so many things when I practice 50 cases with sir. He was in every cases I do some mistakes and I learn in each and every steps from him. From the beginning, specific data gathering, general template, eyes and summary, and the breakdown of the eyes in the management part, in each and everything. So when I start, the thing is that I already missed some things, but when I finish the course, I learned so many things. The best thing is in my course is the confidence. When I finish the course with sir, I feel very much confident. When sir tell me, I am very happy about your performance. So this the word goes my OSCE, and I win this OSCE in first attempt.
I think
Okay,
Dr. Habib, I think Dr. Javed also asked that
Once
about
can I
your
ask a little bit
partner.
before
Did you have any regular partner? I think Dr. Javed, you asked this also. Dr. Habib,
yes,
did you have a regular partner to practice?
Actually, sir, I feel very difficult so find out a partner
Find a
because I am
partner,
on the
right?
yes, sir, very difficult because sir, I'm living in Bangladesh, so most of the partner are in Pakistan, US. So time is a very fact. When I am working, I am in office. He was in office. He was when he was back. Then I was his office. So this is the main fact, sir. So I feel very difficulties, but Allah will help me a lot. So last 2 months that I did a very hard jobs and finding some partners I will share with them, and I did it, sir.
Oh,
It's exactly, Dr. Habib. I'm facing the same thing. I mean,
actually, sir, nowadays, sir, the right partner is the very important things to pass the OSCE.
Okay, one more thing, actually, Dr. Habib, Dr. Zulfikar, and Dr. Ganga also, I will ask that apart from, and what materials you use for study. I mean, there is Oxford Handbook plus Dr. Usman course, and I think I'm using another one also, CSA, this, and the 3-4 books. So there are many books are there in the market. So for OSCE. So
Dr. Arif can, I think, respond here. Dr. Arif can start.
Yeah, thank you, sir.
Yeah.
So, Dr. Javed, regarding this question, first of all, I would like to add one more.
Yes.
Because your partner, be careful that whenever you are choosing a partner, he should also be well prepared, or he must have that sort of inclination to get past. That is very important. if your partner is not well prepared, it may rather drag you back. That's my experience. Okay, so I know that everybody who are I'm not downsizing anyone, but problem is that sometimes your partner might have some deficiencies, and you if you practice with him, then you have to guide him also. So better, my suggestion is, whenever you are studying with any of the partners, better you, when you are doing some and you are taking coaching with under a mentorship of some mentors there, both do the same coaching and then practice in that fashion. It would be helpful. Number one. Secondly, there are many resources are there. Okay, but very important that you get the gist out of it, because there are huge things that you have to memorize. But in history taking, you have to complete that history taking only within 4.5 minutes. If you go beyond that, you won't be able to complete the case. Did you get it?
Yes,
Dr.
yes.
Javed?
Time management
Yeah.
is very important. Yes, you are right.
Yes. Your history taking, your examination skill, all should be blended in a perfect rhythm and combination, so that you can get the required time to give the patient the counseling and meet the concern. That is equally important. So be careful that resources you can get, but doing regular and continuous practice and upgrade yourself. Find out your own weaknesses. That would be, I think, most important, and only a mentor can help you. Sometimes partners, yes, if he or she is having the experience, he can or she can guide you. That definitely I would tell you, you can take. But if you are not well prepared, then it would be a little bit problem.
Right, Dr. Arif. Dr. Arif, please
Thank you,
be
Dr.
with
Zulfikar.
us. Dr.
Yes, sir.
Javed, you can continue also, no problem. But I have some response from Dr. Habib as well. Uh, if I start from Dr. Arif's suggestion, and the question was the learning materials, resources. So if you say resources means some text in a paper or a PDF, actually, OSCE is not in that state right now. You can get a lot of resources for the reading, rather to say, store of the knowledge is even in the internet nowadays, very available, very nice. No need to
Yes.
mention any author also. Okay. As I have gone through many types of resources since my preparation time, more than decades back, there is an, what I say, evolution and the modification in the resources. The same things are not currently active. So day to day, we need to be updated about the resources. Whatever the book you are having, you can follow it just as a store of the knowledge, not for your performance. Performance definitely need practice. And for AKT resources, what you had in your past life, I think as a knowledge, it is enough. Just to make it perfect for the perfect performance in your practice life, this is the OSCE. And possibly I have a plan to guide you the difference between OSCE. The knowledge is same, but what is the difference between AKT and OSCE preparation? Maybe in a few days later, you will understand the importance of this. If I go back to Dr. Habib comment about the mistakes, or what I say, some puzzling issues happened to him. Dr. Habib, be with me. You told that the examiner couldn't tell you the findings of the bronchial asthma, right?
Yes, sir. When I did the examinations, the
They
examiner
didn't tell.
he did not tell me, sir. He was just মানে অন্য মনস্ক স্যার ওইটা
I
একটু বলা
understood.
চলে
I
আর কি
understood. I understood.
when I just
Differently,
told him, yes sir,
distracted
when I
mind,
told
with
him,
a distracted mind, right?
yes, when I told him, I'm really little bit surprised that I will do some mistakes in examinations, sir, respiratory system examinations and nothing else. So I am be confident about the examinations part, but
Very
I have
right.
some confusions, so that's
Very
why
right.
I am just allowed to tell loudly, is there any positive findings, then examiner will attentive, and then he will give me the examination findings.
That I
So
like to,
this,
that I like to comment that you have done very nice thing, which is called controlling the consultation. Understand? That
yes,
means
sir, yes,
you have controlled your station. Not only to
yes,
the
sir.
surrogate, you control the examiner as well, indirectly and very gently. This is the glamour in your performance. Okay? If you become silent, asking nothing and proceeding, your performance would not be better. No doubt. No doubt. And Dr. Litton is here possibly to ask anything about.
Yes, assalamu alaikum to everyone.
Yeah.
But, at first, I would like to congratulate those who have passed in recent post examination, probably which has been held in Sri Lanka.
Right.
I have few questions. First of all, is there any center-to-center variation regarding pass rate? The examination right now is occurring at 3 examination centers. We almost all of us have known about that. Sri Lanka, Pakistan, and India. Is there any variation of pass rate in between these centers?
Who
First question.
I think
Second question.
who one by one, Dr. Litton, who can answer this
Yes.
question really? Do you have any experience of knowledge, information, the variations of the
Sir,
pass rate?
actually, I did not get the actual informations, but there is some sharing informations that in Pakistan there is actually no variations, but in India there is it's a new place, and there are some difficulties in exam also. There are not well organized like Pakistan and Sri Lanka that I know for my one of my colleagues.
Oh.
And as a new place, their pass rate is little bit high, little bit. That was shared with my one of my colleagues, but I did not get you a proper information about like that.
But it is
Okay.
not ideally not much significant variations could be there.
Yes, sir. Yes, sir. Like that, sir.
Could be there. Dr. Litton, please, your next one. Dr. Arif to
Sir,
tell anything? Dr. Arif to tell anything?
Yes, sir.
Please,
Actually,
please. Dr. Litton, be
uh,
connected. Don't switch off your audio. Please.
actually, this it might happen whenever there is variation between the center to center. I can remember one time, because this is not about the MRCGP International. I would rather cite the example of MRCP, because we all know that there is center in the Kolkata. Kolkata, we have MRCP center, and one time happened that there is worse result from Kolkata. I think a significant amount of fail from that center. And what happened? The Royal College reacted. After that, they usually they got the lesson. But from India's point of view, in Indian centers, the Chennai and Bengaluru centers are the better centers, as per the feedback from the candidates. So it might happen that, but overall, at the end of the day, the Royal College and the dignitaries are there very much cautious, and they usually take feedback from the candidates. So it might happen 5 to 10% cases, not that much variation in my eyes.
Right, Dr. Arif, I am also in the same opinion.
And sir,
Yes,
one more thing, sir, I will forget regarding the experience of Dr. Habib. One of my day candidates, one Sri Lankan candidates, he complained to the GP college dignitaries that one of the surrogates, because I also went through the same surrogate, he complained that during the surrogation, during the consultation, the surrogate remained sleepy.
Could happen, Dr. Arif.
Yeah, because maybe she was a little bit hypothyroid.
Dr. Julper, is it obstructive sleep apnea? stations?
No, not
Oh,
like
right.
that.
One of
Maybe,
these
yeah,
stations.
may happen because obstructive is not like that. Maybe she got a little bit tired because
Drowsy,
the
Dry.
tired,
temperature
right.
inside was
Yes,
very
yes.
cold. So in
Mm-hmm.
any temperature, the body get relaxed. So if she
Mm-hmm.
got a little bit, what to say, a little bit relaxed, and she got a little bit
So,
unaware of the situation. So it
yes,
might happen.
it is the most common in second sessions because
Yes, yes, yes.
after lunch they are
They
it is
become
most
tired.
common. Yes, sir.
Tired,
Yes, sir.
actually.
Thank you.
Yes, yes.
But
If
sir, in the Colombo, sir, there is a agenda. There in a sleep apnea, obstructive sleep apnea patients, he was giving the data, and after the sometimes he was sleeps. This is the agenda of this station, sir.
I think
That's why I'm
very
telling.
nice to say in this way. I invite Dr. Ganga also here because Dr. Ganga can share also her case maybe in a different way. The patient may express you not by the your voice, even by the body language. So obstructive sleep apnea case can sleep in front of you. This is very lively could happen there, and you can enjoy also, no doubt. Dr. Ganga, I think you can say about your case. There was some possibly she got makeup also so far. I remember.
Yes. Yeah.
It's a very new experience. You can add, please.
Yeah, there was a 35-year-old lady with complaints, not complaints, but just she was asking, Doctor, I need Ozempic and Botox. That was uh, the thing she said when I entered the consultation room. So she had makeup on her, and uh, it was the station was. The examination was not required in the station, so only the makeup and the history was there. So we have to decide what to do. So that is the case is telling about. So that is a counseling station regarding Botox and Ozempic.
Right,
So
right. So it could happen the about makeup and other. That means the surrogates, what Dr. Arif also said, surrogates are being more trained up. The OSCE started actually more than decade from Pakistan. They organized initially, and then day by day this being upgraded. So the surrogates are also well trained. So really they will be helpful, and they would be helpful all the time. And again, I like to add also, Dr. Litton, you can ask next question a little later. Regarding
Yes.
the controlling of the station, I like to add my story. My story means I will tell only 1 minute. In my time, it was in Colombo. From there, I passed. In Colombo, in my station, suddenly when I start good morning and something, the young lady was having joint pain and others. I was continuing to talk to her. Suddenly, her mobile phone rang unexpectedly. Then she became puzzled. She was looking to the examiner. Then what could I do? Then I assured her by telling, don't worry, take your time. And then she got relaxed. It could happen. That means I am actually controlling my consultation. That is excellent thing might happen to you. If anybody can do it, it will be very excellent. Don't be puzzled. Don't be frustrated. You just take it as usual and you will get definitely good score, no doubt. Coming back to Dr. Litton, please. Your next question.
Uh, yes. In the realty station, among 14 stations, like, right? So, yes. Uh, is there any chance to give real cases or any dummy cases they provide actually?
There is no real case, no doubt. I can answer these questions, so no need to ask others. There is no real case. All are dummy, all are surrogate,
Sir,
right?
I have, sorry to disturb, sir.
Yeah,
I
please,
have,
you can add.
yes, sir. Sir, nowadays, I think they are taking the real cases, sir, because to me, what appeared to me, my first case was acute pyelonephritis, and patient was having fever. And one case, sir, I may not be 100% accurate, but whenever I was examining those two patients, the patients were having the findings of right-sided pneumonia, and the patient was having almost 100 plus temperature, I think.
Could
So
be they are trending, might have, but
yes, sir.
as a
Yes,
rule
sir.
of the
But
examination till now,
yes, sir.
according to the
Dummy cases,
regulations,
mostly dummy
these are
cases.
the
Yeah.
dummy cases. Rather, better
Yes,
to
sir.
say all the cases are dummy case. You have to practice as a dummy case, not the real
Yes, sir.
case. This
Yes,
is
sir.
the thing. Dr. Litton, any
Yes, sir.
more?
Excuse me,
No,
sir.
sir.
Dr. Ganga
Yes.
having something. Makeup, Dr.
Yeah,
Ganga's case, makeup
no.
could produce like real case by giving them
Yeah,
makeup.
so
Yes, please.
the one case just came to my mind now. There was a case with diabetes and hypertensive nephropathy.
Yeah.
That patient actually had ankle edema. It
Oh,
was
I see.
real,
Could
and
be.
I told that he had a very distended abdomen. So I was wondering he is having ascites, and I checked for that one, and it was like a real patient. I think he had actual edema in the face as well.
I
I
like
don't
to
know
add also
whether.
a little, Dr. Ganga. What I can comment, and I recall my one of my case. It can happen that some patient might have some features of the disease designed for the station, but usually the real patient are avoided because they cannot continue 14 station too much time. There might happen something
Yeah,
wrong
I agree.
physically, so they don't allow or accumulate. But some chronic situations, for example, patient might have some ankle edema, they know each other, chronic patient, cold patient, inactive state, they can, but not for actually for the diagnostic purpose. Maybe that could you do some findings or not to make your performance better. For example, if they select a patient of the dyslipidemia, they can select a patient having arcus senilis in the eyes. They can select a patient having xanthelasma like this, but not
Yeah,
100% real case. But patient might have some findings. What Dr. Arif said, that patient might have fever. It may not be pyelonephritis, but as a part of the infectious disease, possibly patient having warm body and have fever, and he didn't mind or she didn't mind to come to the station. It can happen, but as a rule, really they are not real patient. This is the rule. Thanking Dr. everyone. Dr. Leighton, if you have further question, you can ask later also. Any further? Dr.
Sir,
Leighton.
Assalamu alaikum.
So Dr. Nasir here. Welcome, please, Dr. Nasir.
Yeah. First of all, many congratulations to all the colleagues who passed the exam. Few questions. As one of the doctor asked, use multiple resources. Sir, I think better to go for one resource. If we join your course, better to go for it. If we select more books and all these things, then there is a puzzle.
I think
This is my
so.
personal.
I think so.
Yes.
What other experience? Other colleague, not only asking those who passed, asking any other colleague also, those who are practicing with anyone about the Dr. Nasir's comment. I agree with you. It actually OSCE is a exam of the performance, not
Yes.
huge knowledge. So if you follow the many resources, your technique and other, you should have your own strategy. This is the summary. Whatever,
Yes, sir.
but it is not easy to pick up summary by self. And
Yes.
you have
Mentor.
only 2 or 3 months time before the exam, right? Suppose the Royal College set 4 times exam in a year. When you apply, you are getting only 2 or 3 months time. Beforehand, you were not much serious. When you got the seat, you become serious. So how much resources you can follow? In your
Yes, sir.
earlier time, if you pay 1 year, 8 months like that, you can try the resources which is best suited for you, rather come to there and follow it. It can be done. But
Yes,
in the
sir.
later time, I
Hmm.
think only one. Dr. Nasir, very nice suggestion. Please, any further thing?
And sir, one another question or suggestion. Sir, every diet, the case will be deviated, not the previous one. Some cases, patient cases, repeated, and some are deviated from the main thing. So, my question is, can we go by book or can we go flow with the patient? Because if we go in our mind that I have to ask this question, this question, this question, so most of the time we will distract.
If I like to answer your question, for example, your
Yes.
case was bronchial asthma, okay? And you could see in our recall discussions, a lot of different varieties of the bronchial asthma case happen. Even social issues also, social stigma, psychological issue, many issues are there, not only diagnostic issue. So
Yeah, diagnosis is
not always diagnosis. In the latest time, the last time,
yeah.
we gathered the checklist of the case. For example, checklist for the bronchial asthma or shortness of breath, like that. If the diagnosis is the bronchial asthma, a lot of informations are accumulated. You need to go through this checklist A to Z. But remember, in your station, you don't need to touch each and every point in your station. And it is rather discouraged also. Go with the checklist. It is discouraged. Rather, go with your patient. What patient is telling to you, what patient's giving the findings to you, what patient's actually asking you, you're just with the patient. But Dr. Arif said, you have to be busy only 4 minutes or at best 4.5 minutes in the history or data collection part, not more than that. But you can continue the talk in the later part of your consultation. Relevant few, even the history related, very important thing you might miss before, you can ask. So the checklist only for the knowledge, but you have to go with the patient. And even Royal College examiner's opinion, the feedback, those who can collect, you will find there also, they comment the candidates actually done mistakes. They are going with the checklist, so-called checklist, but not with the patient. It is a bad observation from the examiner panel.
Yes,
Please,
sir.
Dr. Nasir, next.
And most of the time, what we are doing, even me, we are preoccupied with the diagnosis. Then the problem arises from there.
Dr. Nasir, preoccupation of the diagnosis, I like to say it is not absolutely prohibited. You could have some diagnosis in your mind, rather differential diagnosis, not only one. And there is a tradition of the exam. For example, preparing for the OSCE, some doctor preparing for the PACES. There is a different flavor of preparation and different flavor of diagnosis also could happen. So absolutely, we cannot say that we should not be preoccupied. Rather, to be that we should not be serious about our preoccupied diagnosis. I like to comment in this way. Dr. Nasir, anything more?
No, sir. Thank you.
Thank you,
So nice.
Dr. Nasir. Other colleague who want to talk, please open.
Yes, sir. I
Dr.
want to
Aslam,
pay,
please.
sir.
Please.
Thank you, sir. Thank you, sir. I just want to pay congratulations to successful candidates, and I enjoyed all these suggestions you given, sir. I agree with you that knowledge is not. There is no limit of knowledge. And as you suggest us, practice. Confidence and practice is, I think, the only key to success. And Dr. Reef has said very nice that in 4 minutes you have to collect the all data. So it is very tricky exam, I think. And,
I think your observation is right. As you are
yes,
listening us today, we agree with this
yes,
opinion. Thank you, Dr.
yes,
Aslam.
yes, sir. Yes, thank you, sir.
In addition, I like to say that nowadays it is very easy to collect the traps. Already you understood the traps. We sat with you in the last few couple of weeks regarding the trap questions
Yes, sir.
designed mainly for the AKT but useful for OSCE informations also. These traps are utilized in the AKT, no doubt, as well as in the OSCE. You need to know the traps rather, not the whole case, whole disease. Okay. If you go
Exactly.
with the patient, you will get through, no doubt. Okay, don't be puzzled. Right.
Right.
And
Thank you, sir.
we will invite you also. We are enriching our the traps information also. More likely within few months we will complete it. Already we have covered some traps, and we are inviting you also in our almost every week with some discussion near about 1 hour regarding the traps of the concept equity as well as for the OSCE. You try to be regular in our sessions. Our coming
Yes, sir.
session will
Yes,
be
sir.
on these because our basic compilation is finished. Already modules are ready, everything is ready. It is now we are in the advanced stage. These are very simple, less issues. You will pick it up easily. In that manner, we prepared. Dr. Aslam, having anything to add?
No, sir. That's
No.
all have been well
Thank
elaborated.
you.
Thank
Thank
you very
you.
much, sir.
Some other colleague open the mic possibly mistakenly, or could you open the mic to ask? No more?
Yes, sir. One last question.
Dr. Nasir again, please. Okay.
Yes. I would like to ask all those who passed, uh, the case in the exam, all were discussed by Dr. Osman, or some variation is also there?
I think Dr. Arif answered the question earlier. The technical things were almost similar, but not the case. I think even then there could be some common issues are there. So far I have gone through the list. Who can answer? Dr. Javed, sorry, Dr. Ganga, regarding this, as it is possibly not, because it was only our small package program of 50 cases. But we have some other records also. Dr. Ganga there?
Sir,
You,
can I share?
Yes, sir.
Yes, sir.
Dr. Ganga, please.
Uh, regarding the cases, I have been in the 50 case discussion with sir, and I think the exam has a lot of cases, so we cannot do each and every case, so that is not practical. So what sir explained, with I think we have to train ourselves for the cases, as there are categories of cases as acute, chronic
Chronic,
cases like
exactly.
that. So
Yeah.
exact case I mean might come or not. We have to prepare ourselves. So the self-confidence we can achieve with a mentor. That is more important, I think, more important than having discussions with your friends. I think because mentor can guide you, and mentor can give you the shortcomings you are having in the cases, your presentation, the management, and everything. But your friends and colleagues can only be in a similar state like you. I mean, most of the candidates are in the same situation, or maybe a little bit high up or a little bit down. But for this OSCE, I think we need to get a higher standard of training. So I think training with a mentor is more important. So the case-wise cases we cannot predict, and it will come. So any case we can tackle if we have a good training.
That is right,
So
Dr. Ganga. Dr. Ganga, may I ask you, possibly you told me before you have collection of 600 or 700 cases with you. Am I right?
yeah, yeah,
Yeah. But what did you told me before? I can remember now. But it was not possible to practice that amount of cases. Okay, and it is
yeah,
impractical. I agree with you. Only you learn the tactics or techniques,
yeah,
but you need to go through the case. Is it like rather to say the newspaper reading, like all things? You just have an idea so that your memory can help you,
yeah.
but you cannot practice that much. I think only 100, 150 cases is enough to pass the
Yeah, I
exam.
think we have.
100.
I had two colleagues. We were having the discussion, and I think we did around 300 cases. But unfortunately, all three of us did in the same day, and none of the cases we practiced came for
Yes,
our exam.
this is the thing. But question is that did you get any direct scenario you practice with us or you heard from the 50 cases?
No, sir, not the 50
That
cases didn't come. I was
could
unfortunate.
happen. It could happen. If I ask Dr. Habib and other also, they can say that, okay, I have seen the case as it is. But what Dr. Nasir commented, every case is twisted. Okay, every case is twisted. There are some traps. So you cannot get the case as it is. But if you have gone through, practice the case, you will be able to overcome the station. This is the idea nowadays. It is not just repetition of the case, but topic is repeated. Asthma, hypertension, dyslipidemia, these are repeated. Tuberculosis, everything. Dr. Habib wanted to add something. Dr. Litton, you can ask later a bit. Dr. Habib, to add
Yes, sir.
anything
Actually, yes,
additional.
thank you, sir. Sir, actually, sir, everyone is identify most of the cases within 1 minute. Within 1 minute. But the hidden agenda, it is inside. So you have to find out to rule out to this. And what is his expectation? What is his concern? You have to rule out this, and you have to break down in management part.
That is the
Okay,
main
and
thing. That is the main thing,
yes, sir.
really.
They will see the are you patient center? Are you patient caring? Are you safe doctor? Is it not? Okay. So how you will go through after 1 minute? You will find out each and every cases is common. In the recalls, you will find all the cases. But how you will proceed these cases? Are you a safe doctors or not? Are you sending the patient in the home or hospitals? So they will see this. So you have to be confident, and this is the most thing that you have to control yourself. You have to patient center. This is the thing.
Thank you, Dr. Habib, to add this thing. This is a very technical thing. Again, I like to say, like Dr. Ganga, also, actually, you need to practice acute case, chronic case, counseling issues, angry patient, breaking bad news, investigation, report description, likewise, or some preventive what is called lifestyle cases, psychosocial issues. These are the main headlines, not the name of the diagnosis. I think that's enough for discussion. Dr. Litton, to raise any new issue?
Sir, last question. Thank you, everyone, for answering all my questions. Last thing, what is the current passing rate
Current
among
passing
these
rate,
three
who
cells?
can say?
Statistically, how much candidate would appear in the exam, and among them, how is the passing rate right now?
Sir, can I share this?
If
Because one
if
of
you know, if you know, you can share, but
sir,
authentically very difficult to answer it.
yes, sir. One of ex-examiners, I know him. So he was telling me in last exams, it is a 48%.
48%, near
Yes,
about
sir.
50%. Not bad, really. 48
Yes, sir.
means a huge number, rather to say. But passing rate depends upon many things also. You know, there is a now the jam of applicants. They are not allowing more AKT candidates to appear because there are a limitation of the chances within 6 years. So I think it will not give any impact of the pass rate. Those who are able to pass, they will pass. They will not restrict technical thing that I will not pass more than that. It is by nature, it will come. So 48% or 50% at best, maybe like that. Anyway, if no more, we can proceed further.
Yes, Dr.
Dr.
Usman, can I
Javed,
ask?
please, please,
I would like to ask, in fact, a bit different question
please.
with one colleagues who passed, Dr. Ganga, Dr. Zulfikar, and Dr. Habib.
Yes.
That I mean, there is any specific dress like you have to put on suit or tie necessary, or you can put just bent coat
Dress
or
code. Dress
white.
code.
Yes, dress code. Number two, how
One by
much?
one, Dr. Javed, please. Better. You
Okay,
can be you
first
be
question, this
connected.
one.
Yeah, Dr. Arif, are you there, or Dr. Habib also?
Yes, sir. Dress code, there is nothing specific, but I saw the Sri Lankan candidates there. They were wearing ties, and the inside of the hotel, where the examination was taking place, it was pretty much cold. So one of those candidates, because we were all suffering. So I think if you can put a sweater, that will that will protect you from cold, because you might not be able to perform fully in those cold conditions. That uh, I perceived.
I like to add, Dr. Arif,
Yes, sir.
in addition to your saying that there is no specific dress code that you
Yes.
need to wear the apron or other thing. But
Yeah, few.
dress
Sorry,
will
sir.
be. Sorry, please, Dr. Arif.
Yes, sir. I saw a few candidates who were wearing aprons.
Aprons could be no problem.
Yes,
But
sir.
and everybody should know about the infection control strategy, also important,
Yes, sir.
which is very well evaluated in PACES exam. Same is true for the OSCE also. So to
Yes, sir.
minimize the infection, you need to know how to do it. Usually a
Yes, sir.
t-shirt color will not be very arrogant color,
Yes, sir.
and the fragrance will be mild like
Ma-
that. But again,
Mhm.
you need to consider the season also. Is very winter or inside more cold, like in a 5-star hotel there will be inside cold. So you can wear, or you can have an additional cloth if possible inside. According to the situation, you can wear additional cloth, no problem, no problem. But no specific. Even if anybody use the tie, Dr. Arif, I think it is against the infection control strategy. Tie
Yes, sir.
usually will not be good suited there.
Sir, actually, I have a saying because I appeared so many exams in the last couple of years. So I didn't see that the inside temperature is so low because it were happening in the hospital setting. The temperatures were kept as 24, 25 like this. But in that hotel, actually, I don't know why, because it was so much cold.
Might be
So
some
much cold.
technical issues over there
Yes, sir.
that time.
Yeah,
Thank you.
almost all the candidates were complaining about it, and
Yeah,
even I had to take some precaution. I told and I apologized to the my patient that yeah, I'm a little bit shaky due to that cold. They said that it's okay, we can understand. So
right.
if it like happened that you are having some problem with the AC, or yeah, you can directly tell to them, and just in very polite you can tell them that yeah, I'm feeling a little bit approach, please pardon me. I directly apologize to them
No
that
problem.
it's
If you need
yeah.
overcloth also extra, you just have it. After
Yes, yes.
telling them that I cannot tolerate the cold, I need to wear a blazer or sweater, no problem. No problem.
Yes, sir.
Dr. Javed, next query, if any.
Yes, next query is how much weight is there for good English communication skills of the doctor and the surrogate or the patient?
Dr.
How
Arif
was the
can
case
tell,
of
because
surrogate?
Arif have a lot of experience, as he said, and it is our pleasure also. Dr. Arif OSCE, he passed recently. Dr. Arif
So,
Paces
I mean,
passed many
English, of
years before.
course.
Dr.
English, of
Arif
course.
passes MRCGP as well, and Dr. Arif appeared many other exams. I think
He could
his
guide us here.
experience regarding the
Sir,
OSCE surrogate, Dr. Arif can tell. English
sir,
language.
actually, if although my fluency is not that good, but on that day the examiners were so fluent that upon seeing them and in their presence, my fluency already got improved. But it is not an offense. But they usually expect that you have a good fluency. Otherwise, you will not be able to deliver all of your messages within the time. So better to practice your
Right.
fluency also.
Right, right. Dr. Arif, I like to add
Surrogate.
Dr. Javed, please give me a few seconds.
Okay,
If
sure.
any Arabs colleague here today, I don't know, in my last experiences, few years,
Yes, sir.
unfortunately, our Arab colleagues are very shaggy and they are
Yes.
reluctant to improve the language also. Even I heard that they are choosing the mentors who are in Arabic origin and talking in Arabics in the session. But I'm very sorry telling that it is the time now to improve your English language. There is no marking extra for the English language. But if
Yes.
you cannot communicate, you are not comfortable to talk to the patient, and patient is not comfortable to talk to you, it will actually downgrade you. Your performance ultimately will not be perfect and glamorous one. So English language indirectly very important to improve. And Dr. Arif said to improve it by practice with your colleague or other in your workplace. It is the best way. Dr. Javed, any more?
No, thank you, sir.
Very
Thanks, sir,
nice. Very nice to see you.
for
If
all of us.
any other no more question, my last thing to ask my beloved colleagues, those who have passed, only to you. Last question is, After appearing the exam, Dr. Arif, Dr. Ganga, as Dr. Habib, and any other colleague also, in addition, Dr. Sandamali possibly couldn't join today, that after your performance coming out from the carousel, did you think that you could pass one by one? Dr. Arif, please.
Sir, if I honestly, to be honest, I had actually no expectation from me because the time limit was so small, and I just got my seat and I didn't prepare it before. So, to be honest, sir, it is only from the blessing from Allah and my mother and you, sir, that you with your. But actually, yes, sir, I would definitely say that my previous exposure with the MRCP exam, PACES exam, the communication that we used to build up with you, sir, so that immensely helped me. And one of the colleagues who were telling that doctor, because we were discussing few things before that, he told me that doctor, you may pass because of your communication. So from that, yeah, I'm indebted to that colleague that if any person having good communication skill who can deliver the message correctly and in a simple language, he or she can pass easily.
So did you
That I
feel
got.
this feeling? Did you feel this, that you could
Yes, sir.
pass?
Yes, sir. This is the effect of prayer from the superiors that my exam was exceptionally fast and exceptionally to the point, including the history. I completed almost 90% of the cases within 9.5 minutes.
Fantastic.
Last 30 minutes, I
Fantastic.
was almost silent.
Fantastic.
I don't know
Fantastic.
why, but it happened, sir, on that day.
So may we go to Dr. Ganga to answer this question in very short word. Did you feel that you could pass after your performance?
I'm very humble about my performance, but uh, yes, I think after finishing the exam, I knew that I am going to pass the exam. Touch goal that I have got the blessings from my parents and my mentors and my family. Yeah, I thought that I will pass the exam with the performance I did during the exam.
Very
So
nice. Very nice to
I
hear
had to
from you,
believe.
doctor.
Yeah.
Yes.
So I was very confident about the exam because I had trained with you, sir, and with my colleagues. And I have followed some other courses in Sri Lanka as well, and have done
I
some other
understood, yeah, doctor. I
mock test
possibly
as
at the
well.
later time, at the near the end of your courses, possibly I was also predicting that both of you could pass. I can
Yeah,
remember.
yeah, you
I
told
can
that.
remember also. Very nice of you. Dr. Habib, please, what did you think after your exam?
No, sir, no, no. After exam, I think, sir, I forgot to exam two stations to explain, and two stations I forgot to about the main concern of the patients. I did not get any time for that. But actually, sir, I'm be confident about all of the stations, and some stations I did before the time, at least 10 to 15 seconds before the final bell. I did it. So I did not get that I will be passed, but Allah make all the things easy for me. This blessing is the blessing for me.
Everywhere is a lesson. Lesson is that the bottom line is you may pass or may not pass. It is only the feeling. Okay. And to make all the stations perfect, it is not the rule. We
Yes, sir.
might do
Yes.
some mistake, some error could be there. No need to be frustrated. And those who becoming a new preparing doctor now, don't be frustrated that possibly I cannot pass. Initially, it can happen. If I can remember also in my initial time, how bad it was. I could have my records many years. A few years before I removed it. I was smiling that how I was in my previous time. But later on, everything become okay. So those talk today, we are very grateful in this session very nicely, and you got some experience from them. It could give you the pathway to design your own way. So thanking you. I urge you to be with me few minutes more also as a summary part to discuss with you. I think it will be helpful for you. So already you have seen me with my introduction before, as it is our name of the institute and our contact information in the group, you know. And just to tell you something that there's somebody asking about the system wise. Usually we don't encourage more to go with the system wise. I told you knowledge is endless. You need to practice according to the strategy, according to the technical aspect of the case preparation. This is the category. Already many of you have heard it. And we designed this actually mixing the system with the category so that all categories can be covered. This is the your blueprint for preparation and updated plan. Recently, especially I observed after going through the recall also from the last Colombo exam, relatively a big change happened in the strategy in the stations. So today is no more time to discuss with you. In future, we will discuss it, and we have updated this format or proforma also, how to proceed with. Hopefully, within few days, we will invite you to come with us to interact, especially those who will be new and preparing for the coming exam. The updated plan of the OSCE case encounter. You are invited there. And as you didn't ask further more question, I think right now also no more. Even then you have, you are having any question, you can ask me. Otherwise, this is for you, the coming days for your preparation package for you. For the limited active participant, you can communicate with us for coming exam, or even I remember Dr. Habib actually prepared him in the last January, not for the Colombo time courses. So better to prepare earlier, one step earlier. I think it is better so that you can have time. Dr. Arif, as he is excellent in his preparation in previous lives, it was possible for him that within maybe not more than 2 months, so far I remember, Dr. Arif, right? Even
Yes,
not
sir.
more than 2 months. It was possible exceptionally for him. But in general, you might have 4-5 months in hand. It is better. So
Better.
even if you are not appearing for coming India exam, you are planning for the next the diet, better prepare with us in the coming time from the first week of June. Okay. And those who are very new, try to improve your base of the OSCE. Come to the practice a little bit later, otherwise you will be frustrated. So for this reason, this is the module, and within few weeks it will be more updated in future. Just we will discuss with you later on in your personal talk, not today. So with these few words, inviting in the next session within few days for the OSCE, and Sunday and Monday usually we sit with AKT and the OSCE candidates. Try to spare your time in the week of these 2 days, usually more on the Sunday. So be in touch in the OSCE group and you will be updated. With these few words, thanking you very much and gratitude again to all of you, those who participated and took part actively. Thank you very much, Doctor. Thank you. All the best.
Thank you, sir.
Thank you, sir.
Nice
Sorry.
talking.
See you. Nice
Thank
to